So my project was really looking at how do we provide safe, effective care for people in the hospital with neurodevelopmental disabilities, but through a family and patient engagement approach. So there are a lot of concerns about patient safety and effective care in acute hospital care settings. We see more frequent admissions, we see higher rates of complications, poorer outcomes in this patient population, and we also see that healthcare providers really struggle with how to effectively care for patients in this population. So we have healthcare provider struggles, but then we also see the same kind of struggles with patients and families because they feel that the providers are undertrained. These patients are more likely to report inadequate healthcare provider skills and 4 times more likely to report being treated poorly. That is of grave concern to me as a healthcare provider. So then I wanted to look a little bit about emergency room specific data, because that's where a lot of times our first point of contact is for patients with neurodevelopmental disabilities. So I looked specifically at data for people with autism spectrum disorder. And we see an increased use of restraints in the emergency setting. We see higher rates of restraint use, but then we also see higher rates of utilizing the emergency room for people with autism. So we have kind of this increased patient population as well as increased healthcare providers who don't know what to do in this setting. So when I was doing my literature review, I really looked at this quote for inspiration, and it says, "These hospital failures appear to arise from limited knowledge and skills of staff, as well as the negative attitudes." And that you're going to see in my project, that's really where I focused my energy, was the knowledge, skills, and attitudes. And these difficulties contributed to the fear that people have when they access healthcare, and the factors that facilitated appropriate care models in some studies by adjusting to needs were the exceptions rather than common experiences. So I really took this quote to heart during my development of my project. So my question was, what knowledge, skills, and attitudes do healthcare providers need to guide the patient and family through this experience? So this is a simulation experience, so you can see the mannequins on each side, but this is what an emergency room looks like. There are many, many things going on. So how do we as healthcare providers guide a patient and family through this very stressful experience? So I kind of took my project into kind of 4 key points. So I was focusing a lot on the knowledge because I'm an educator of nurses, so I really focused in on the knowledge to begin with. But the quote from the previous slide really talked about knowledge, skills, attitudes, and then I wanted to envelop my project in a patient and family engagement approach. So that's why it's at the top, because it's kind of guiding the knowledge, skills, and attitudes of my project. So like I said, I first focused on knowledge. So I did a few, I was involved in some few all-day trainings. I did a talk with school nurses specifically about how resources for people with autism as well as supported decision-making. So kind of really focusing on the rights of people with autism. I was also involved in the training day for registered nurses with the other advanced medium-term trainees. And then I was also involved in another all-day training. And when I started to look at these numbers, I thought, this is a drop in the bigger bucket. We were training people who wanted specific knowledge on this. So they probably had some sort of experience that motivated their learning. But there are a lot more healthcare providers out there that don't have that extra level of motivation, and they're providing care in the hospital setting. So then I started to think about, okay, well, what skills did those people bring to the training? And they had previous education. Most of them, like I said, were nurses. So whatever education they got in their nursing school, they had that. Then they had their experiences in the hospital or in the school setting. And then we started to think about, what about simulation? What if we had a simulated experience in the previous education as well as experiences to kind of drive that experiential learning? And it came very clear to me that although we have knowledge and we have skills, what really drives learning was this change in attitudes or dispositions. And the most impactful experiences are just that, those it's that actual experience where you bring knowledge and skills into your practice. And like the previous speakers were talking about, a lot of nurses in these trainings said how impactful it was to hear from the patients and family themselves about what it felt like to access care. And so I feel like using patient and family input really drives the change in attitudes. So this is a little bit of a definition of what family engagement is. It's really changing care for patients, family members, and healthcare professionals by having a concentrated focus on patients and families. So when we're looking at patient and family input, the consistent key messages that we got from patients and family members were the importance of communication and a truly team-based approach, not just within the healthcare team itself, but actually utilizing the patient and family in that team approach. And then the aspect of person first, so not just person first language, but actually embodying that behavior in your interactions with patients. We included self-advocates, families from varied backgrounds and experiences, and we've also partnered with various organizations. So we were lucky enough to partner with the SED here, which has been amazing, as well as Autism Speaks and the Developmental Disabilities Nurses Association. And so what we're looking at is really taking all of the experiences from this project and building it into a simulated experience. And so what that means is that there's different levels of simulation. So we have to look at the pre-briefing activities because a lot of nurses aren't sure how to interact with patients with disabilities in general. So we have to guide the learning experience with pre-briefing activities, so case studies, so that they understand how to communicate. Then we give a background of the patient and simulation experience. And an important part of simulation is that it's really important to reinforce that it's a safe learning environment. So it's, like you saw on the slide before, it's usually either an actor or some sort of mannequin, and the nurses are able to practice their behaviors and practice their interactions in a very safe learning environment. So during the simulation, there are usually 1 to 2 people actually doing the simulation, and then there's a handful of people observing. So it's not just the people involved in the simulation, it's everybody doing the simulation and observing are engaged in that learning activity. And the most important part of simulation is the debriefing process. It's that experiential learning, but then also that knowledge gain of the debriefing process. So what feelings came up, what thoughts were there, what went well, and what were areas for improvement. So kind of taking this bigger picture approach, I really want to use knowledge, skills, attitudes with patient and family input to develop a simulation experience. And there are simulations out there that are called a simulated patient. So that means that it's an actor. There's no simulations out there where we actually use a mannequin. And it feels like the way to disseminate this knowledge across nursing schools, across hospital settings, is to really use a mannequin, because you can kind of program that more easily than training an actor to have that experience. This is the first time that a simulation, because most times when we're developing simulation, we draw off our own experiences as an instructor, but this is the first time that we're crafting a simulated experience using a patient and family input to say, does this feel right? What are your key takeaways for the nurse? What would you like us to highlight in the debriefing process? So we're really focusing our system change with knowledge, skills, attitudes, with a patient and family input approach. I want to thank a lot of people in this room. You've been very involved. 2 people who I didn't put on here because I specifically want to call out are Robin Hansen and Aubin. You have been incredible in the various iterations of this project, so I just want to thank everybody and the self and family advocates who've helped me put this together, so thank you.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies upcoming events, and how you can help make a difference.